In this video, we will demonstrate an upper quarter screen, conducted on one side of the body. In a real assessment, testing of both sides is imperative and should be started with the unaffected side. In the compliant and discerning patient, a sensory examination can be helpful to determine the precise location of a lesion. The dermatomes tested are C5, C6, C7, C8, and T1. Three key features to proper test include the use of light touch for testing the spinothalamic tract, demonstrating the test with patients having the eyes open, testing both sides of each dermatome by asking, does this feel the same on both sides? And it should be documented as equal, diminished, or absent.
Hi, my name is Michael Gallegos. I'm a student physical therapist. What's your name?
Kim.
Hi, Kim. Today we're going to be doing an upper quarter screen, and what this entails is it's going to be a test for your sensations, your muscular strength, range of motion, posture, and reflexes. Is that okay?
Okay.
Okay. So the first thing I want to start with is going to be a sensory screen. So what this is, it's going to require me to touch certain parts of your neck and your arm. Is that going to be fine?
That's fine.
Okay. So what's going to happen here is I'm going to have my two fingers. I'm going to place my fingers right here, both sides of your neck, and then you're going to tell me if they feel the same. And then I'm going to go from there to the next portion. You're going to tell me if they feel the same throughout.
Okay.
Okay? So what I want you to do is close your eyes. This will be a test one, okay? So right here, you're going to tell me, do these two feel the same?
Yes.
Okay. So let me go ahead and start the test. So you keep your eyes closed. Feel the same?
Yes.
Okay. And we'll come right here. Does this feel the same?
Yes.
How about this?
Yes.
Okay. Does this feel the same?
Yes.
All right. And if I could have your hand, turn your hands this way. Does this feel the same?
Yes.
How about these right here?
Yes.
Right here? Okay. And last one is going to be in here. Do these feel the same?
Yes.
Okay.
Abnormal findings include different perceived sensation between left and right sides, abnormal perception to light touch, such as pain, burning, or lack of a sensation. More detailed testing should be performed with a pin in order to determine if it's a dermatomal area, peripheral nerve, or other distribution. The postural screen is used to determine symmetry of the upper quadrant. Make sure to ask the patient to remove clothing items and look for symmetry comparing sides.
Okay, so now we're going to go ahead and check your posture. Okay, so all I'm going to do is just walk around and then look at your alignment. Is that fine?
Yeah.
Okay. I'm going to brush your hair from the side. Okay.
Abnormal findings might include a winged scapula, excessive thoracic kyphosis, and asymmetric musculature. Features to proper screening range of motion include looking for compensations, checking for quality of movement, and testing the uninvolved side first.
We're going to go ahead and check to see how well you can move your neck and your arms. Okay? So what I'm going to want you to do here is I'm going to want you to bend your neck forward. Okay? And then I'm going to go ahead and apply some extra pressure to it just to see how it feels, or just see how far you go. Okay? Now extend your neck backward. Okay? Again, apply some pressure. Okay? Now your neck to the side, like this, your ear to your shoulder. Okay? That with pressure. Okay? Next, I'm going to have you turn. And then now ear to the other shoulder. Okay, turn the other way. Okay, so now I'm going to check your shoulders, okay? So what I want you to do first, bring your arms straight to the side. Sorry, straight to the air. I'm going to go ahead and add some more pressure. Okay, down to your sides. All right, very good. Okay, now up right here. Relax. I'll go ahead and do everything for you, okay? All right. Right here. So then now you're going to go ahead and hug yourself. Okay. All right. So the last one I'm going to have you do, hands right here, you're going to touch the back of your neck. Okay. And now back here, hands to your back. Go. Next, extend your elbows out. Now bend them. Right there. And then I'm gonna have you grab my hand, we're gonna shake hands, okay? So you're gonna shake your right forearm. Sorry, before that, let me have you do the motion. So go ahead and bring your forearms inside and out like that. Okay, now I'm gonna go ahead and check it. Okay, back this way. All right, you're gonna do your wrists. So I want to see your wrists bend back and forth. Okay, let me add some resistance or some extra pressure to it. And then extend out. Turn you this way. Okay, now with your fingers, I want you to go and extend your fingers out. Now flex them. Extend them out again. All right. Oh, one last thing with your wrist. If you could go ahead and turn them inward and outward. Okay. I'm gonna go ahead and test it and then bring it inward again. Okay, just relax. Okay. Now we'll bring it outward. Okay. Last thing I want you to do is I want you to go put your hands over here to your sides, across your chest, and I want you to rotate. Okay, bring it back. Okay, rotate again. Okay. Right in the middle. Now we'll go ahead the other way. Okay, now we add some more resistance. Okay.
Abnormal findings include aberrant movements, such as the Gower sign, lack of range of motion, and reproduction of symptoms with active range of motion or overpressure. The Gross Motor Strength Screen assesses muscle strength at myotome levels from C5 to T1. 3 features include having the patient sitting or standing in a comfortable position, pressure should be applied distally, and stabilization is placed proximal to the muscle being tested, and asking the patient to hold against resistance.
I'm going to go ahead and assess your strength of your muscles. So I'm going to have you do a couple movements, and from there I'm going to apply resistance, and you're not going to let me move you from that position. Okay? So the first one, if you could go ahead and lift your arms just like this. A little bit, there you go. I'm going to push down. You're not going to let me move you. Okay? Hold, hold, hold. Perfect. The next one, hands to your side. Bring it up a little bit. I'm going to push down, and you're not going to let me move you. Okay? Ready? 1, 2. There you go. Same thing. You're going to don't let me move you. I'm going to push up now. Okay? Ready? 1, 2. Great. So bring your wrist up like this. I'm going to pull down. Don't let me move you. There you go. Opposite way. Elbows up. Here to hold. Hold, hold, hold. There you go. Extend your fingers out. I'm going to push in. Don't let me move. Don't let me put your fingers together. Now hold it. There you go. And then last one. Bring your thumb up and in. Right along here. And I'm going to push inward. Just make sure you hold it. Okay. Hold, hold, hold.
Abnormal findings include aberrant movements, lack of range of motion, and production of symptoms with active range of motion or overpressure. Reflexes are assessed for symmetry and briskness at the C5, C6, and C7 nerve roots. Key features include making sure the patient's body segment remains relaxed, identifying the correct location of the tendon, and striking through the tendon with a firm yet quick tap with the reflex hammer.
Ms. Escobar, the next thing I'm going to test on you is going to be your reflexes. So with this, I'm going to have to check your reflexes right here, here, and right here. Okay? It's going to require me to give you a little tap on the arm, so just don't be alarmed, but is that okay?
Yes.
Okay. So I'm going to have to have your hand rested on mine, so bring it up right here. Rest your arm right there. Just relax, and I'm going to do all the work. Okay?
Normal findings include a hyperreflexive response that would warrant a grade of 3 or 4, a hyporeflexive response that would warrant a grade of 1 or 0, and asymmetric reflex between the 2 limbs tested. The following pathologic reflexes are used to determine the presence of an upper motor neuron lesion. Key features include: patients should be comfortably seated or lying supine, neutral posture of the spine, and reflexes should be tested on both sides.
Ms. Escobar, I'm going to go ahead and check a couple more reflexes. So the first one, I'm going to need your arm again. So if you could go ahead and rest again. I'm just gonna have to strike right here again. 1, 2. Okay. The next two are gonna be on your feet. Okay. The first one I'm gonna do, it's gonna require me to scratch the bottom of your foot, so just don't be alarmed. Ready? Just relax. Okay. The last one I'm gonna do, I'm gonna just push up on your foot really quickly. All right. Okay, the last thing I'm going to do for you is I'm going to check a reflex in your hand. So I'm going to need a borrow your hand for you for a minute. I'm going to flick this finger. You're just going to relax. It's not going to hurt or anything. Okay, just go ahead and relax. Okay.
Abnormal findings include inverted supinator reflex occurring during the brachioradialis MSR, and flexion of the fingers is observed. In a positive Babinski, the big toe will extend and the remaining toes will fan out. Clonus is considered abnormal if it is sustained, 5 beats or more. In a positive Hoffman, when the fingernail of the middle finger is flicked, there is flexion of the thumb and the index finger. Thanks for watching!